Lower risk of otitis media, LRTI, diarrheal diseases, allergies, eczema, meningitis, and inflammatory bowel diseases. All of these are some of the benefits that comes under breastfeeding. Now, how is a mother benefited by breastfeeding? Breastfeeding enhances early maternal-infant bond. It helps in bonding of mother and the baby, as the mother is spending more time with the baby and the baby is able to smell his mother. So that helps in accomplishing the maternal-infant bond. It aids in involution of the uterus after delivery. The long-term breastfeeding helps in loss of excess weight acquired during pregnancy, since the calories are actually getting transferred to the baby. So yeah, it helps in the loss of excess weight as well. Documented long-term effect of breastfeeding includes reduced risk of breast, ovarian and endometrial cancers. Now, storage of breast milk. Alright, so it depends on the condition where we are storing the breast milk. It happens that a mother has to go for her doctor's appointment or to her job or whatever. So yeah, we can store breast milk as well, so that we can feed the baby accordingly. In a room where the temperature is 25 degrees Celsius, we can store it for up to 6 to 8 hours. In insulated thermal bag with ice pack, we can store it for up to 24 hours. In a refrigerator where the temperature is 4 degrees Celsius, we can store it for up to 5 days. Freezer compartment inside refrigerator, the temperature should be minus 15 degrees Celsius and we can store it for up to 2 weeks. Combined refrigerator and freezer with separate doors. With minus 18 degrees Celsius of temperature, we can store it up for up to 3 to 6 months. In chest or upright manual defrost deep freezer, the temperature where lies for minus 20 degrees Celsius, we can store it for up to 6 to 12 months. Now we'll come to breastfeeding positions. The most common position is cradle hold position. This is the most common position used by mothers. Infant's head is supported in elbow. The back and the buttock is supported by arm and lifted to the breast. Second is football hold position. The infant is placed under the arm like holding a football. Baby's body is supported by the forearm and the head is supported by the hand, as you can already see in the slide. The other one is sideline position. The mother lies on her side, propping up her head and shoulder with pillows. The infant is also lying down facing the mother. It allows the new mother some rest. Obviously, a mother is usually in a sitting position when she is feeding the baby. Post-delivery, the body is already exhausted. So sitting for longer hours is going to exhaust you even more. So we need to change breastfeeding position to give rest to our body as well. So we can try this position. Australian hold position. This is also called the saddle hold. It usually is used for older infants. It is not commonly used by mothers because we don't usually see this position, but we can use this when the baby has some sort of ear infection or runny nose. So he is not able to lie down properly, or he's having some breathing issue due to cold. So we can use this Australian hold position in that case. Now, barriers to effective breastfeeding. Lack of confidence in mothers. I would like to really know, what do you understand by this line? Lack of confidence in mothers while breastfeeding. How can it be a barrier to breastfeeding? Exactly. So she doesn't have a confidence. She would feel कि पता नहीं position ठीक नहीं है, whether the baby is sucking or not, whether I am not able to fulfill my baby's needs. बहुत सारा confidence जो होता है प्राइमरी मदर यूजुअली जो होती हैं उनको कॉन्फिडेंस का थोड़ा लैकिंग होता है, तो इट कैन बी अ बैरियर टू इफेक्टिव ब्रेस्ट फीडिंग. सिंस ब्रेस्ट फीडिंग इज ऑल अबाउट हार्मोनल, it's all about your hormones. If you're not happy, if you don't have confidence, if you're stressing about something, be it anything, it is going to affect your breastfeeding. Your breast milk would not be secreted that much if you are not in a healthy state of mind. Believe that breast milk is not sufficient. This is very common. Even I have faced it. You have that thing, you feel as if your breast milk is not sufficient. Your baby keeps on constantly crying. It might be due to the cluster feeding schedule. When the baby is in the early stages of growing, he goes into cluster feeding sometimes. So what actually happens is a mother thinks that my breast milk is maybe not enough. I'm not able to fulfill my baby's feed. So that is why the baby is crying. His needs are not met. But this is not it. We have to seek counseling for that, and we have to be keep reminded about that stress and happy hormones and all these plays a major role in breastfeeding. Lack of adequate support system. Okay, this is very important. If you have family around yourself and you don't have their support, for example, you have people who keep on telling you like ऐसे नहीं करना है बच्चे को, ऐसे दूध नहीं पिलाना है बच्चे को, ऐसे लेटा के रखना है, and आप बैठ के क्यों पिला रहे हो, constant nagging, that also leads to lack of adequate support system. When you are feeding your baby, you need a stronger support system who would motivate you and encourage you to breastfeed. It itself is a very painful experience. So you need a motivation to keep on going. History of previous breast surgery, as explained, someone told me about the breast surgery thing. Yeah? So if you have undergone any breast surgery, that would also lead to a barrier in breastfeeding. Breast engorgement, cracked and sore nipples. These are to be treated as soon as possible. As soon as you find any sign of sore or cracked nipples, or you have tingling sensation, whatever you have to consult your gynae for that. And retractile nipples. This also happens. You need to take your gynec appointment for that, because as soon as you recognize stuff like this, you have to take care of it to initiate proper breastfeeding. Embarrassment. Okay, this also happens. We have this preconceived notion कि आप बाहर हैं, आप सबके सामने फीड नहीं करवा सकते हैं. You have to find a private place to breastfeed your baby. तो you get embarrassed by it कि यहाँ पर नहीं कराना है, इन लोगों के सामने नहीं कराना है, ऐसे नहीं कराना है. You can keep your shawl or stuff with you and you can breastfeed your baby wherever you want. That is a very natural thing and there is nothing to be embarrassed about it. Jealousy by siblings. Okay. So if you have two or more babies, so what actually happens is when you're giving attention to the youngest baby, so it happens that the older sibling would get jealous कि मम्मा तो बस इसी को feed करा रही है और मम्मा मुझ पे ध्यान नहीं दे रही है. It also happens. So jealousy by siblings can also be a barrier to effective breastfeeding. So ऐसे में you have to take help from your partner or any of your family member, so that they can distract them and you can breastfeed your baby quietly. Chronic illness in mother, psychosis or cancer. Chronic illness हो गया, depression हो गया, psychosis हो गया, cancer or any other disease that you've been suffering from, that would lead to effective breastfeeding. क्यों? Because it is going to release stress hormones in your body. It is going to make you feel bad about yourself, make you feel guilty about yourself, which will further deplete the milk secretion. Contraindications to breastfeeding. HIV, HLTV1 and 11 infections, adult T-cell lymphoma virus. These are some of the diseases in which we are contradicted to breastfeed our baby. Active tuberculosis, herpes lesions on mother's breast, infant with inborn error of metabolism, galactosemia, phenylketonuria, mothers on certain medications like anti-cancer therapy, radioactive isotopes, etc. Barriers to bonding. A bottle places a physical barrier between mother and the baby. Okay, bonding, we have already established that breastfeeding is a very effective way of bonding between a mother and a baby. But if you start using bottle in the very early stage, the bottle would place a physical barrier between mother and the baby and that bond will not be formed. Less skin to skin contact. Obviously, if you are not breastfeeding your baby, the skin contact will not be there. Less eye contact. And the hormonal connection between the breastfeeding mother and baby cannot be experienced by the bottle feeding mother. Other options if breastfeeding is not possible. Mother can still use her milk even if she decides not to breastfeed. Due to any reason, if a mother is deciding that she cannot breastfeed the baby directly, she can use a breast pump, either electric or manual, cup or bowl feeding, spoon feeding, feeding syringe, nursing supplementer, She can get milk from donation bank. It happens that in some cases mothers are not able to produce milk. In that case, she can use milk from donation bank, formula milk, and animal milk. In animal milk, we can use cow's milk or goat's milk, but nothing is as compared to breast milk. Is there anything you want to ask regarding breastfeeding? In certain cases, actually, it has been established कि HbA1c में क्या होता है, if the mother is on medications, तो वो डॉक्टर्स पे डिपेंड करता है. समटाइम्स डॉक्टर्स डू अलाउ द मदर टू ब्रेस्ट फीड द बेबी. वो उनके इन्फेक्शन की सीवियरिटी पे और वो मेडिकेशंस नहीं ले रहे उस पर. हाँ जी. HIV में तो कॉन्ट्राइंडिकेटेड है, उसमें तो कॉन्ट्राइंडिकेशन.
If mother wants, so only breast milk she can give. If she is active HIV positive, she is not taking any treatment, then it is contraindicated. If she is taking the treatment, that means she can allow. हाँ,
एग्जैक्टली. तो
अगर उसका ट्रीटमेंट चल रहा है, मेडिकेशन पे है, तो सी कैन गिव, बिकॉज जो CD4 सेल काउंट्स है वो हमारा उससे मेंटेन हो रहा है, ड्रग से. अगर वो नहीं ले रही है तो फिर वो नहीं देगी. दैट्स ऑल.
जितने भी वायरल डिजीजेज एंड ऑल है, इट ऑल डिपेंड्स फ्रॉम केस टू केस. किसी किसी केसेस में ऐसा होता है इफ द मदर इज ऑन एक्टिव मेडिकेशन एंड इट इज ऑलरेडी कंट्रोल्ड बाय